In this DVD, the patellofemoral resurfacing prosthesis with the system EMI-CAP is shown. The procedure is performed with the patient in supine position and the knee having a range of motion of at least 100 degrees. The procedure starts with arthroscopy, watching inside the joint and looking for a confirmation of the diagnosis. In this particular case, you can see a patellofemoral joint in which only the patella has a bad situation of a grade 3 and 4 of outer bridge classification of damage. The femoral side of the joint is in good condition. And you can see on the back of the picture the patellofemoral ligament that is in a perfect situation. Thus this patellofemoral joint has no instability. The open procedure starts with a straight incision of cutaneous and subcutaneous tissues, and then with a lateral approach through the capsule. We can observe the patella with this damage and then the femoral surface. With a 4-point pressure device you can center perfectly the trochlea and you can advance the guide pin. Then the cannulated drill should advance until the proximal shoulder is flush to the cartilage surface. The tap is then advanced in the pilot hole to the laser mark. The fixation stud is inserted until the laser mark is flush with the native cartilage surface. The stud should be cleaned and the trial cap is inserted to detect if the device is deep enough. If not, you should use the driver to deepen it more. The contact probe is then inserted over a centering shaft. The contact probe is then rotated around. Reading the contact probe is possible to obtain the positive value of the superior and inferior offsets and the negative value of the medial and lateral offsets. In the sizing card, these values refer to the appropriate size of the implant. The circular scalpel is then used to create a cut through the articular cartilage. The guide pin should be reinserted, and then you should choose the right size of the reamer based on the measurements of the superior and inferior offsets. The bone debris is then removed and the taper is cleaned. Place the sizing trial into the defect that matches the offset profile of the chosen femoral trochlear component. Confirm the fit of the sizing trial so that all margins are congruent or slightly recessed to the edge of the surrounding articular surface. It is then important to prepare and implant the patella component before the final placement of the femoral component. With a curved device inserted in the femoral stud and the knee bent at 90 degrees, is possible to mark the patella in the right place. The drill guide is then inserted through the alignment guide. After a reaming, the patella centering shaft is inserted over the guide pin until it reaches the first or most distal laser mark. The contact probe is used in the same fashion as used for the femoral component. The measurements are reported on the sizing card so that we can choose the appropriate size of the implant. Select the 3 mm patella reamer. Advance the patella reamer over the patella centering shaft until it contacts the blade stop. Clean perfectly the bone and check with the trial that the resection is perfect. The bone is then cleaned again and we can continue with the cementing of the component. You should not use a large amount of cement and the insertion of the component is allowed by the implant holder that works with suction. The patella clamp is then used to keep in place the implant. The preparation of the patella is then finished, removing additional osteophytes. The trochlear component is then seated using the same implant holder with suction and hammering the femoral component strongly. A dynamic evaluation of the patellar tracking is very important. The patella should move without any clank at least for 100 degrees. The wound is closed in a routine fashion. The X-rays show a perfect alignment of the implant. And the patient is able to walk without crutches since the 3rd day post-operative. The extensor mechanism is perfectly working. And the patient is able to bend the knee at least at 90 degrees since the 3rd day post-operative. I thank you for your attention.